Indeed.
So you obviously started in home health kind of by chance, but it seems like you really enjoy it. So do you feel like home health as a setting overall like is pretty impactful? And do you think it like helps drive good patient outcomes versus, some of the other settings? Okay, can you tell us about that?
So I always heard in school, like consistently for 3 years, anytime we would talk about settings, like my alma mater, are we allowed to say what school we graduated from?
Yeah, go for it.
Yeah, Texas Tech, Recum Tech.
Yeah.
So at Texas Tech, I don't believe we even had a clinical that was in home health. And I remember a lot of our professors, kind of said, well, if you want to get into home health, at least they said this about, I believe, both home health and travel. If you want to get into home health, wait a year or do another setting because that's not where skills are developed. And I really, 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 after being in home health for 2 years, I hate that take because it's really like, if you're just the kind of person that you're going to coast or you're not passionate about getting better, then yeah, like you're probably going to do that in any setting. Yeah. I think in home health, the opportunities to have mentorship are less. And then you're also with a patient one-on-one. Mm-hmm. So you're not really able to bounce off ideas of other clinicians or see what other people are doing. So in that sense, I think like, I can understand why people say, oh, home health isn't a place where therapists go to get better or to get better at what they do. But I think that's much more driven by the person as opposed to the setting. So having said that, so that's what I'd always heard about home health going into it. Like, just, hey, home health is not a place where you go to like sharpen your skills or become a better therapist. Like it's easy to coast, it's an easy job. And I just really don't like that take. Outside of the fact that I believe growing as a therapist or getting better at your job, whatever it is you do, like all that motivation needs to come intrinsically, like it needs to come from you. You need to be motivated to do it. Home health is just amazing. Like you're with the person in their most familiar environment. In home health, we don't bill for we don't bill for time. So it's per visit. So I have patients that I spend I have patients that are close to being discharged and they got everything down pat. So, I'll spend like 20 minutes with them going over exercises. I have patients that are, really, really, really in a bad spot. So like I'll spend an hour and a half with them. Like I've had visits that have been up to 2 hours just because I needed to get everything done with that patient. And when you are with somebody and they're in their home and they're struggling to move around in their home and they see that somebody's spending like all this time with them in the home, that's very impactful for them too. So I think because they're in a very intimate environment and you're not necessarily on, like, you can spend as much time with them as they need. Like in outpatient clinics, we bill for units and, I believe it's like 7 or 8 minutes at least to bill for one unit. But in home health, it's just visit based. You just have such a ability to form relationships with people because they're at their most comfortable and they're in their most familiar environment. So I feel like you really see the real side of them as opposed to if they're in the hospital or if they're coming to you at a clinic. You're really seeing them and their family. And I believe that that's why this setting, I may be biased, but like I honestly believe you can make the biggest difference in somebody's life in home health. 100%.